oftentimes people fail to realize that they have the symptoms of a depressive illness, and then they go through life without treating it. But it becomes a problem when that depression interferes with your everyday activities. So how do you know if you suffer from depression? Here to share some of the types and symptoms with us is Dr. Bradley Wajda with Esano Incorporated. Welcome back to you, Doctor. How are you?
Just fine, thanks.
Your take on that story that we just saw?
Well, it's absolutely a huge problem in terms of finding something that's going to keep patients in remission. You know, there are certain categories of antidepressants that will, you'll actually develop, in essence, a tolerance to over time.
And we're going to talk more about the treatments a little later on in the show. But first of all, how would you define depression?
Wow. Well, generally, what I'd use to define depression would be the criteria for major depression, because there are so many different types of depression. We've talked about a few of them here in the past, postpartum depression and bipolar depression. However, the symptoms of depression deal with down mood, can be irritability in kids, but in essence, I guess in short, you'd call it a persistent sadness, a persistent down mood.
Would you call it a weakness?
Absolutely not. It's not a weakness or a character flaw. Yeah, everybody's experienced some down mood, some sadness, and it's appropriately so, whether it's life circumstances or, you know, it could be a loss of job or marriage. However, one of the things that most people miss is they miss that point when it stops being a normal reaction and it becomes a problem.
Let's go back and talk about the types of depression. I know you mentioned a few of them just a second ago, but the types, some of them being major depression.
Right.
And then the second one here, I don't understand this one.
Oh, dysthymia.
Yeah, what is that?
Well, that's a chronic lower grade depression. It's something that's present for at least 2 years. And that is a depression that, when I'm talking to my patients, I describe it as a depression they can function with. Okay.
Explain to us a little bit more about major depression.
Well, major depression is a depression that, by definition, does affect your ability to function. This is a down mood or sadness that affects virtually all aspects of your life. It'll affect your appetite, your sleep, your level of energy. You'll have thoughts of either suicide or death at times. Not everybody will have each one of those symptoms, but there are a group of symptoms called criteria, and if you have 5 or more of those for 2 weeks or longer, then you qualify for the diagnosis.
And you should go see a doctor. We're taking a look at some of the symptoms here, which include depressed mood, as you mentioned, loss of the ability to enjoy pleasurable activities, loss of energy, having difficulty concentrating, significant weight gain, or even weight loss. So that should be a pretty obvious one. Insomnia or even too much sleep, and as you mentioned, thoughts of death or suicide, feeling worthless or guilty, and just having restlessness and moving slowly.
And that last one's interesting because it's called psychomotor agitation or psychomotor retardation, and it's very distinct. When you look at somebody, they'll look like they're moving very slowly. The psychomotor agitation will be somebody who's clearly very agitated. It's something that's almost beyond a restlessness.
And do we sometimes consider depression to hit people that are older, younger, or what's the ages?
All ages.
Oh, really? Okay.
All ages. And it is a challenge when you're treating kids, but kids do come in with depression.
And a lot of the things, obviously, that worry kids don't worry us, but we as parents should really take that into consideration and think, oh, well, they're worried about their homework, when that could be a cause, maybe, or
absolutely.
just schoolwork or peer pressure?
Peer pressure is an important one because as adults, the social life of a child or an adolescent may seem somewhat frivolous to us, but to them it's their entire world.
That's true. That's true. And then a lot of the causes you've mentioned before, but I kind of want to reiterate as well, of stressful life events.
Yeah.
Divorce and job loss being two of the big ones.
Right. Also, medical causes. You know, thyroid illness being one that I see rather frequently as a cause.
Okay.
Substance abuse. There are, I think we put on the slide genetic factors, and in fact, if you have a parent or a sibling, brother or sister, that have depression, you're about 3 times more likely to suffer from depression.
Oh, wow. Okay, well, all of this is great information, but coming up next, Dr. Wajda is going to stick around to talk to us about how to prevent depression as well. So stick around for that. A lot of great information.